Although abortion and reproductive health have emerged as a major focus in the 2024 U.S. presidential campaign, less attention has been paid to other health policy topics. Nevertheless, the results of the elections could have important implications for matters such as the uninsured and underinsured populations, healthcare costs, Medicare, and Medicaid. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Jonathan Oberlander, a professor of social medicine and of health policy and management at the University of North Carolina at Chapel Hill. Professor Oberlander has written a perspective article about healthcare reform and the 2024 U.S. elections. Professor Oberlander, do you think that apart from abortion, healthcare hasn't received substantial attention in this presidential campaign?
I think that's right. We have had during the past quarter century or so several elections where healthcare was really front and center, including 2008 and 2016. And healthcare reform really has not been a primary issue in this election.
So you say in your perspective article that repealing Obamacare was a centerpiece of Donald Trump's first campaign for the White House in 2016. So what's changed on that front?
I think that as time has gone on, the Affordable Care Act really has transformed American health politics, and it is part of the status quo now and difficult to dislodge. And Donald Trump learned that when he was president, and Republicans had a repeal and replace campaign in 2017 that not only failed, but cost them politically and underscored the political perils of trying to take out Obamacare. And in the intervening years, the program has only grown stronger politically as more states have embraced Medicaid expansion. Millions more Americans are enrolled in the ACA's health insurance marketplace, and the protections for consumers against insurance discrimination have become entrenched. And so the Affordable Care Act was not easy to take out in 2017, as demonstrated by the fact that Republicans going to do it. It's a lot harder to take out in 2024.
Nonetheless, as you say in your article, Trump has given mixed signals about how he would approach the Affordable Care Act if he were elected. So what policies do you think he's likely to pursue?
I think it's really an open question about whether Republicans would aim for an ambitious repeal and replace campaign. And as you say, President Trump has given very mixed signals about whether we should replace Obamacare or leave it alone. In terms of what they might actually try to do if they didn't attempt, and you would need, in order to really go for repeal and replace, you would need Republican majorities, of course, in the House and Senate. If they did not try for that kind of ambitious repeal, they could take administrative actions to try and undermine the law, which President Trump did the last time he was in office after legislative repeal failed. And perhaps most noteworthy is they could simply do nothing at all. There are subsidies, enhanced subsidies that were enacted during the Biden administration that make private insurance plans under the ACA much more affordable for consumers. Those subsidies are set to expire in 2026 unless Congress acts. And so one way to really damage the Affordable Care Act would simply be to do nothing, although that could trigger a political backlash.
And then what about beyond the ACA? What actions do you see Republicans potentially taking that could affect Medicare, Medicaid, drug prices?
I think there would be a very significant chance that Republicans would try to reform Medicaid, change its financing, and convert it into a block grant program and limit how much the federal government pays out to states, which would result in substantial cuts to Medicaid spending. And if that happened, it would put a lot of pressure on states, and it would probably increase the uninsured population among low income Americans by quite a bit. They also may try to once again encourage states to move towards work waivers in Medicaid for non-elderly, non-disabled beneficiaries. On Medicare, it's harder to discern. President Trump has many times said that he does not think it's a good idea to cut Medicare. The question is, would a Republican congressional majority agree? The one area where you might see Republicans really move is in trying to repeal provisions of the 2022 Inflation Reduction Act that allow the federal government to negotiate drug prices for Medicare beneficiaries for select medications. There's been a lot of comment among Republican policymakers that they would like to reverse that. Of course, those provisions, to the extent they're known, which is limited, by Americans are actually quite popular. So again, anything to reverse that and anything to cut Medicaid as well would be very risky politically.
As you say in your article, Kamala Harris has similarly had a different health policy focus than when she ran in the 2020 Democratic presidential primaries. So, how have her plans or political realities changed over time?
I think that Vice President Harris has put forward a very incremental agenda to date in healthcare. She ran for president in 2019 in the Democratic primary. She backed a hybrid version of Medicare for all that would enroll all Americans in Medicare, although they could choose private insurance plans. She no longer supports that plan. Nor has she supported, at least in publicly in the campaign, what President Biden ran on in 2020, which is enactment of a new public option that the uninsured and many insured Americans could join a new government program, in other words, or lowering the Medicare eligibility age from 65 to 60. She has not emphasized those proposals. Instead, she's really gone for more incremental ideas, talking about the federal government assisting and providing relief for persons with medical debt, expanding the provisions in the Inflation Reduction Act to negotiate drug prices beyond Medicare beneficiaries. So, really, what she's offered is not a sweeping vision of healthcare reform, but really keeping the ACA and building on the ACA in an incremental way.
Given the lack of consensus on where healthcare reform should go next and how to address the persistent problems that we see, what steps would you expect Harris and the Democrats to take if they're elected?
I think if Vice President Harris wins the election, there's no question that they will take administrative measures, as the Biden administration has, to try and boost enrollment in the ACA's health insurance marketplace. They would work with Congress to try and extend those enhanced subsidies that make ACA insurance plans more affordable for consumers. It's also possible they could look to do something for the low-income Americans who live in states like Florida and Texas that have not expanded Medicaid eligibility under the ACA and are caught in what's called the coverage gap and have no affordable options. That's something they could look towards. I think you could also see a Democratic administration revive ideas that came up in the Biden administration but weren't enacted, investing more money through Medicaid and home and community-based services, and perhaps thinking about expanding Medicare benefits towards vision, hearing, or dental services.
And then finally, what are you expecting in the way of health policy discussions or proposals over this final stretch of the presidential campaign?
Well, as a political scientist, I have to say this campaign has been filled with surprises. So who knows what next week will bring? I think one thing that's interesting coming out of the debate between former President Trump and Vice President Harris is the ACA did come up at that debate, and President Trump once again vacillated a bit on whether he wanted to repeal the ACA and talked about not having a plan in response to a question, but concepts of a plan. I don't know that we'll see that, but we did have Senator Vance, the Republican vice presidential candidate, talk very recently about ideas that have long been popular in conservative policy circles about allowing folks who are healthier to buy different kinds of insurance policies and creating, in essence, high risk pools for those who are not healthy. So I think it's possible over the final stretch of the campaign, you actually may hear more about the ACA, its future, and its potential repeal and replacement than has been the case the last few months.
Thank you, Professor Oberlander.